Yeah, I think the younger parity animals certainly are more stressed as they come into the herd, just because of the fact as the gilts enter the herd to develop the herd immunity, so it's a challenge to make sure we get the vaccinations and doing the proper vet to vets with the source farm, so that you understand the health status as the gilts come to the farm, so we can match that up with the vaccination protocol and make sure we do the feedback, whatever we need to do to get that animal ready to enter the herd. And again, that becomes more of a challenge on those animals to make sure they enter properly and they have all the proper immunity by the time they get to that first farrowing event.
We just have to go back to the drawing board on what are all the inputs into our pig production cycle and which of those can contribute to sow mortality. And then we go measure on farms that appear to be over or underrepresented, where we can find them, what are the differences in those inputs. Then we start to tweak those things in farm-specific situations and say, can we affect the outcome? And if that looks good, then you start to put it through the scientific process.
For the infectious causes, I think what we've seen in several instances, talking to veterinarians and producers, if they spend a lot of time really going through the gestation barns after feeding, trying to identify those animals early on, maybe that just have a cut or a scratch on their leg, and getting those animals treated proactively. I think when people have done that, they've very consistently seen a decrease in sow mortality, and I think a lot of that has to do with they're just catching the infections really early.
Number one, as an epidemiologist, I'd urge producers to start measuring pathologies and recording them and seeing how they affect subsequent performance of the sow. Do some analysis on your own sows. Everyone thinks that small litter size predicts small litter size. My argument would be there's something driving that small litter size that's common to both those events. And when we've studied lameness, when we've studied sow condition, especially skinny sows, we've seen that as a better predictor. So that's one factor. Understand your own herd in more detail. The second area is simply to understand the true cost of mortality and imagine what investments are justified. Because it's not only a cost in terms of replacing the animal, there's an opportunity cost because it results in empty space in the sow herd. Often these sows that are producing litters that are affected not only end up dying, but before that point, they have progeny that have poor performance. And once we start adding up all these factors and outcomes out of these, out of a sow herd with a high sow mortality, we see there's a huge opportunity to increase productivity, and especially in the quality of progeny.
I think from producer's standpoint, what can you do in your herd to help reduce the mortality situation if your numbers are higher than where you want to be, is just to make sure we do that individual pig care every day, and going out and checking every animal every day. And what we've seen is the herds that have fast intervention on problem animals tend to have the lowest mortalities. And again, it comes back to early detection and then proper treatment and proper handling of that animal.